In today's video, we will talk about depression. So, what is the difference between depression and mood swings? Mood swings happen through the day by events that you involved in, like happy moments or sad things, and easily altered through the day. But depression is something bigger than that. Cause it affects the way you think and behave, last from few days to several years, long-lasting and intense form of depression called Major Depressive Disorder, MDD. Now, how do you know that you have MDD? By having 5 or more of these symptoms. Number 1. Persistent feeling of sadness and hopelessness. Number 2. Lack of interest in doing most activity. Number 3. Increase or decrease in appetite combined with weight gain or weight loss. Number 4. Too much or too little sleep. Number 5. Fatigue and restless. Number 6. Difficulty making decisions and thinking and concentration. Number 7. Multiple thoughts of death. Number 8. And finally, a suicide attempt. Now, with some statistics, the average age of depression is 32 years old, and 14.8 million adults in America only are affected by depression. 6.7% of them are above 18 years old. Now, let's talk about the cause of depression. Number 1. Genetic factors, like having someone in your family with MDD history. Number 2. Stressful life, like job and relations. Number 3. Hormones imbalance, like what happened through menopause or during pregnancy. Number 4. Biochemical reactions. Let's dig into that a little. Doctors have found that chemicals in the brain of MDD patients are work differently than normal people. And the bigger factor that plays the most important role here is cortisol elevation. How it affects the brain. Cortisol is known as a stress hormone that releases through stress time, obviously like depression. But due to increasing depression and stress, cortisol production increase and start affecting 3 parts of the brain: hippocampus, prefrontal cortex, and amygdala. In hippocampus, cortisol increasing for a long time cause slow production of new neurons and cause the neurons to shrink, and that lead to memory problems. That happens exactly with prefrontal cortex. With amygdala, which is responsible for facilitating emotional responses like fear and pleasure, long-term exposure to cortisol lead to enlargement of amygdala and more activity, and that with the disturbance of the other parts of the brain cause sleeping problems and hormonal disturbance, which lead to losing control on actions and emotions, which makes people with MDD thinking that there is no solution except ending their misery and killing themselves. At the end, please be polite and be careful when you deal with MDD patients, cause they lost the fight and the wheel of their mind aren't in their hand. They need help cause there is hope.